Welcome back. Not-for-profit organization Bronx Community Health Network offers mental health first aid training aimed to combat the mental health crisis. Health educator for BCHN, Jaunia Clarke, and outreach specialist Sherllay Castro joined me to discuss this new program. Thank you both so much for joining me.
Thank you for having us today.
Now, can you brief our viewers on the mental health crisis that is currently happening in our country?
Right, absolutely. But first, I'd like to give you a little background about Bronx Community Health Network. We are a nonprofit organization that was founded in 1996 with a mission to ensure access to quality, affordable health care for Bronx residents, regardless of their ability to pay, their race, religion. We do this at 20 community-based and school-based health centers, and we are extremely proud of our community health and wellness program, which integrates health center clinical care and the important community social support services such as food pantry, SNAP, housing, health insurance, jobs, and education programs that are necessary for complete wellness and optimum living. And over the last year, we've added our mental health first aid training as a component of one of the services we provide. Currently in the United States, an average of 130 people die by suicide every day. And in the last 20 years, approximately 840,000 people have died from drug overdoses, and 1 in 5 people are living with a mental illness. Even though people are hesitant to talk about it, mental health challenges are very common, and people are dealing with these challenges in various ways. And we also know that more people are struggling, especially with the effects of the COVID-19 pandemic and with the recent political climate.
Now, what does this crisis look like in the Bronx?
Right. Compared to the rest of New York City, Bronx residents unfortunately are experiencing higher rates of depression, higher rates of psychiatric hospitalizations, and higher rates of opioid use and drug-related deaths. We know that there's unequal access to care in general, and even more so for mental health care in the Bronx, as well as the rest of New York City. We are working really hard to close those critical gaps in care by acknowledging that access to mental health care disproportionately affects our residents due to many factors such as race, ethnicity, insurance status, as well as poverty.
Now, due to the lack of resources and preconceived ideas about mental health.
Well, I would say that mental health awareness is increasing in our communities, especially since the pandemic. More people want to get involved. The challenges are often due to the social determinants of health. Some people may want to seek mental health support, but it is not often on their priority list, considering everything else that they are managing. For example, housing issues, unemployment. What is great about the mental health first aid training that BCHN is providing is that it is flexible, it's self-paced, and virtual. Therefore, we are experiencing a great response.
Now, has it been challenging to assist people in the Bronx when it comes to this issue?
Like I said, we are having people who are constantly reaching out, interested that they want to receive this training, and thankfully, we haven't had any issues.
Now, in response to the mental health crisis in our country, your organization is offering regular mental health first aid training. Can you tell me more about this?
Yes, so every month we are providing a virtual mental health first aid training. If anyone is interested in taking this training, they can contact BCHN. We also, as you see, we have the flyer on the screen. You can visit us at bchnhealth.org, or you can go to our social media page, which is bchnhealth.org.
Now, Jaunia, what type of skills participants will receive from this course?
All right. So participants can receive a wide variety of skills from this course. At the end of the training, they will be able to evaluate the impact of early intervention on mental health challenges. They will also be able to apply the appropriate steps of the mental health first aid action plan to several scenarios. So one being when a person is showing early signs of a mental health challenge, when a person is showing worsening signs of a mental health challenge, and when a person is in crisis. And then we also focus a great deal on self-care following the application of mental health first aid, because in order to provide the service to our community, we need to make sure that we are well, in our own way. So when you use the skills that you learn in mental health first aid, you are essentially the first line of support for a person in need.
Now, I understand this will also address substance use, and you spoke a little bit about that earlier. Can you tell me about why that's so important to include this?
Right. Yeah. Substance use is something that's touching many of our communities. And many people with substance use disorders have co occurring mental health challenges. And in this training, we teach you how to recognize those early warning signs of a substance use problem and how to respond in a crisis situation when someone has overdosed. We cover the use of naloxone, which is a medication that binds to the opioids in a person's body and effectively deactivates them until they are filtered out of the body. We also discuss how to effectively communicate to 911 and the importance of placing someone in the recovery position if they have passed out for any reason.
Now, I think this is really interesting. A lot of the time, people don't often think of the two being together, but can you tell me about the relationship between substance use and mental health issues?
So there is a risk that someone who has a substance use disorder will develop a mental health challenge. And there is also a risk that someone with mental health challenge will develop a substance use disorder. According to the National Institute of Drug Abuse, the risk factors can be genetic or environmental. For instance, early exposure to stress and trauma. However, despite the high prevalence of comorbidity between substance use and mental health illnesses, it does not necessarily mean that one causes the other. Also, the likelihood of someone developing either a substance use disorder or mental health challenge varies from person to person.
Now, Jaunia, can you tell me this whole program is to help people identify these issues. What would you say are some signs that people should look out for when it comes to friends, family, loved ones, when it comes to mental health or even substance use issues?
Right. So one of the things that people should look out for are just general changes. So changes in their normal behavior. Are they attending work regularly? Are they missing out on school? Things that they once enjoyed, are they still going and enjoying? If they used to go to the gym often and now you see that they're kind of laid back, they're reserved, they're not wanting to go out as much anymore, they're not spending time with family or friends, then you want to also focus on changes in their physical appearance. So if someone was very particular about how they had their hair, they were well shaven, and now you see that they're kind of unkempt, their clothes are a little bit more dirty, they're not, taking care of themselves anymore. Or that you notice that, they are verbalizing that, I'm sad, I'm worried about things, or that, they're having trouble concentrating, whether they're at work or just in a regular conversation, you see that disconnect. Those are some of the early signs that you may notice that someone is struggling with a mental health challenge.
And Sherllay, what would you say to get somebody to speak up? I know sometimes even if you do notice something, it can be very scary to address someone about that. What would you say to encourage that person to speak up?
Absolutely. So, first of all, I think it's important to have the conversation. Oftentimes, people are scared to even ask a question to someone and say, "Hey, are you considering dying by suicide?" They may be afraid that the question might even put the idea in the person's mind, but that's actually not the case. Sometimes people, all they have to do is to actually talk about what they're experiencing. And there are times with this training, we're not typically going to diagnose, rather give people the resources that they need. So you have to be empathetic to the person's situation, make sure that you let them know that you care, that you are available to provide support, and you connect them to the resources that they need.
Now, you talked a little bit about those resources. Can you just tell me more, like what do those resources look like?
Right. So I can chime in on that. But first, I want to kind of reiterate that this mental health first aid training is not a therapy or a support group. It is intended to provide information and build skills, so similar to a standard first aid course. And as Sherllay mentioned, this course does not teach the skills to necessarily diagnose someone or become a therapist. That's not what this training is for. Early intervention is key. So participants, you're going to learn to recognize those early warning signs and symptoms and connect someone who's going through a mental health challenge to a local professional resource. And these resources include psychiatrists, psychologists, social workers, as well as certified peer specialists. So we'll give you that information about local resources that you can give to someone who says, hey, I'm struggling with, a challenge. My mental health is not all great. And then there's also the National Suicide Prevention Lifeline, which is a great resource. And specific to New York City, there's also NYC Well. And these are two resources that are completely free, that offer mental health support 24/7, 365 days a year.
Now, how can people learn more about this program and your organization?
Um,
Right.
you can go to our website, which is bchnhealth.org, or they can follow us on social media at BCHN Health. You can also email us at info@bchnhealth.org, or you can call our outreach hotline number, which is 929-220-8181.
All right. Thank you both so much for joining us.
All right. Thank you so much for having us. And I want to remind the viewers that this is a certified course through the National Council of Mental Well-Being. So participants will receive certification as a mental health first aider, which is valid for 3 years.
Thank you for having us. This is a very important conversation to have.
All right. That's all for our show today. Thanks for tuning in. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always. See you next time.